So we're just going to summarize what we talked about a bit today. Okay, so we talked about private drug costs are rising a little bit faster than public cost. Age matters with prescription drugs. We're an aging population. 2011 was the first year the baby boomers turned age 65. So that maybe is more of a better frame for picture to see that we have this bubble coming from an age standpoint. You need to shop around to get lower pricing because not all drug pricing's the same. That's not from pharmacy to pharmacy, from region to region. Don't be afraid of generics. There's about, I think an industry stat we read in North America, about 0.5% of the people can't take the generic. And I'm not sure if I mentioned it earlier, but the information I also read says a drug like Lipitor has lactose in it, but its generic does not. So there's certain things you need to consider in looking at these things, but don't be afraid of generics because a lot of you are probably going to be moving to this type of arrangement and you're going to have employees questioning you on it. And be aware of specialty drugs. Remember, these are the type of situations you want to look after in your plan. So, we've heard of some advisors talking about removing specialty drugs altogether, and even some carriers working on having a product like that. That is not what us at TRG, that's not what we believe in. That's the true insurance element. You want to have those things covered. Let's just manage the plan better for you.
Okay, so we also learned that Brent's 6'1", I'm about 5'4". Brent's on Lipitor, apparently I'm on Viagra. So we talked about as well the industry reaction, and it just seems that as one stakeholder reacts, the others are moving quickly and quicker than ever to look for opportunities to minimize potential impact. The provinces, we talked about how they're responsible for delivering health care. Clearly they're working hard to manage all aspects of health care. In the past year and a half, they've focused a lot on generic drug pricing. They have announced a series of price reductions in all the provinces across Canada. Generics have reduced in cost about 60 to 70% versus their prior cost to date, and the top 6 are now 82% below the cost of brand. Pharma, they've developed a coupon system to try and maintain their brand market share, and for those that want to try and maintain the use of the brand name drug, there are some drug coupons that you can take advantage of. They also got these wonderful advocacy support programs that they've built to help patients. You think about it in the very vulnerable moment of their life when they're transitioning to this serious therapy that might cost tens of thousands of dollars. They have lots of questions and concerns, and so there's patient advocacy and assistant programs that are really needed in that time of need. Insurers, we talked about that not all of them are working at the same pace, but there's many of them that are developing numerous different designs. And the exciting thing is that there was a time when all the insurers for a decade there were racing down the road of automation, and they just couldn't wait just to automate everything. So nothing really got looked at. The computer looked at everything. And now we're starting to see in some of these designs where there are some insurers that are willing to look one-on-one and manually intervene on a specific situation and look to maybe customize the coverage for that individual. And that's a bit of a return to probably where it needs to be, some healthy balance there. Beware though that there are some advisors out there that are recommending to insurers, and we do hear from a couple of insurers that are actually considering this, designing stuff to remove the catastrophic drug risk, such as capping your drugs at $1,000 a year. And we say, just to be very clear on this, TRG believes very strongly that that is not the path to sustainability. Because of stop loss and the way the insurances work and the sharing of the big risk, literally if you decide to cap your drug costs at a lower amount or get rid of catastrophic drugs, you're literally saving pennies. You're not saving much money, and you're really changing the dynamic and the value proposition you're offering for your people. So the route to sustainability is not going to work if you're going to cap your catastrophic risk. You can look for ways to manage the catastrophic risk and maybe transfer it to somebody else, but not eliminate it. Okay? We talked about the sustainability tools for the member. Putting relevant info in the hands of patients in real time is likely going to be the future. When you're at the point where the doctor's prescribing something, you probably want to have lots of information. And then you step out, it'd be nice to know where to shop and maybe get the best deal for for that drug that you're going to take. So tech changes are going to continue, and it's going to probably quicken. For sponsors, really two things. We talked about design and engagement of your people. If your plan has not addressed its drug strategy to take advantage of these pricing reductions, you probably want to be reviewing that with your senior team. And educating, you cannot deliver these types of approaches without educating members and having a robust process to support them through this transition. So one final comment. Governments who have budgets in the billions, that's with a B, they are making decisions every day of the week to decide what they're not going to cover and what they're going to cut back and what they're going to transfer over to you as an employer. Now, they're the ones that were granted the mandate to say, give everybody coverage, universal care. And they're making decisions every day with multi-billion-dollar budgets to change how they deliver and manage that. And I would just say to all the plan sponsors in the room, if they're making those types of decisions with billion-dollar budgets, what are you doing with budgets that are in the tens of thousands or maybe hundreds of thousands for drug coverage? You really need to understand that you have to address this at some point, and it's probably better, even if you stick with status quo, we really believe that sticking to status quo as an informed plan sponsor is pretty good. But sticking with status quo because you just kind of have ignored it, probably not going to work out very well for anybody.
Thank you, everyone, for listening to us today.